There is a variety of medication available for knee pain, including both oral and injectable medication, depending on the source of your pain. But most medication used by people with knee pain falls into one of two categories: anti-inflammatories and pain relievers, also known as analgesics. Over-the-counter medication for knee pain. Most medication that falls in the anti-inflammatory category also has analgesic effects, says William Bargar, MD, director of the Joint Replacement Center with Sutter General Hospital in Sacramento, California, and a spokesman for the American Academy of Orthopedic Surgeons. The main over-the-counter drugs are acetaminophen, Tylenol and other brands, and non-steroidal anti-inflammatory drugs, or NSAIDs, including aspirin, such as Bayer, ibuprofen, Advil, Motrin, and naproxen, Aleve. These can help with simple sprains or even arthritis. Dr. Bargar points out that even though knee pain-relieving medication is available without a prescription, you should use care when taking it. Be sure to follow the instructions for any medication and read the warnings. What you also have to watch for is that some of these over-the-counter drugs are sold as arthritis strength, and that means they are larger doses. For example, too much arthritis strength Tylenol can damage the liver, he says. Ibuprofen can cause gastrointestinal damage, such as ulcers and bleeding, if you take too much. You have to be careful about overdoing it with over-the-counter drugs for knee pain. Another option to try is glucosamine and chondroitin sulfate, which are oral supplements believed to relieve the pain of osteoarthritis. Side effects can include headache, upset stomach, and skin reactions. The American Academy of Orthopedic Surgeons reports that these supplements might help you during the earliest stages of knee pain caused by osteoarthritis, but it can take up to 2 months of consecutive use to notice any relief. Be sure to tell your doctor you are taking the supplements, because they can interfere with other medication. Prescription medication for knee pain. Prescription medication is usually a more potent pain reliever than the over-the-counter variety. These include prescription-strength NSAIDs and COX-2 inhibitors, meant to decrease gastrointestinal side effects like stomach bleeding. These drugs are typically used if your pain level is considered moderate to severe. The only COX-2 inhibitor currently on the market is celecoxib, Celebrex. Rofecoxib, Vioxx, and others were removed from the market because it was discovered that they led to an increased risk of heart complications. Bargar says that although the data wasn't completely clear, the consensus was to remove Vioxx and Valdecoxib Extra, both COX-2 inhibitors, from the market because of associated cardiac issues. Celebrex was not shown to have a significant increased risk of heart problems. I don't think COX-2 inhibitors work better than standard anti-inflammatories, they just don't have the gastrointestinal side effects, he says. I would prescribe Celebrex for someone who isn't tolerating conventional NSAIDs because of key side effects. Bargar also advises people with knee pain who are taking large doses of ibuprofen regularly to have blood tests every 4 months to check for kidney toxicity and anemia. Injectable medication for knee pain. Injecting medication to reduce knee pain is usually the step between taking oral medication and replacing arthritic knee joints with surgery. Corticosteroids or viscosupplementation with hyaluronic acid can be injected when knee pain becomes severe. Corticosteroids reduce inflammation and offer pain relief and are injected directly into the knee. These injections aren't permanent solutions, and you may need to return for repeat injections every few months, though not to exceed 4 injections in the same joint per year. Viscosupplementation is an injection of hyaluronic acid that lubricates your joint to reduce knee pain and increase mobility. A series of 3 to 5 weekly injections is necessary to complete the therapy. These injections are helpful if you have early-stage arthritis and haven't responded well to oral medication. The whole concept of viscosupplementation was developed by rheumatologists to get some lubrication into the joint, but I found it doesn't work very well, Bargar says. It's also expensive, but a lot of people will try it before surgery. If you have modest knee pain caused by a simple strain, try an over-the-counter medication. If your knee pain or injury is severe, visit your physician for a prescription medication that may improve your particular condition.